Hi everyone, in this video I'm going to talk about two other common injuries seen in youth soccer. The two I'm going to chat about today are patellofemoral pain syndrome and anterior cruciate ligament, aka ACL injuries. Both of these injuries are to the knee. Patellofemoral pain syndrome refers to pain that occurs in the front of the knee, around and or behind the kneecap, and is aggravated with activities such as squatting, running, and jumping. The condition is challenging because there are many factors that play into its diagnosis, but a common one is an imbalance of the hip musculature. The hip muscles that I'm referring to are the hip abductors that help to move the leg away from the body, and it also helps to stabilize the pelvis when you're sitting on one leg. Think about going to strike a ball. And your hip external rotators, which help to rotate the leg away from the body. Think about receiving the ball to turn with it. When these muscles are weak or they're not contracting correctly, this causes the hip and knee to drop into a position called valgus, which increases the stress on the knee joint and leads to pain. The ACL is one of the main stabilizing ligaments of the knee. It attaches from the femur, which is the thigh bone, down to the tibia, which is the shin bone. About 80% of ACL injuries are non-contact in nature, with common ones being a sudden change of direction, landing from a jump, or a sudden stop in motion. Those at highest risk for an ACL injury are between the ages of 14 to 18. However, the incidence of tears as young as 12 years old is increasing. If someone has a full tear of their ACL, that is going to require surgery and at least 9 months of physical therapy. So when you think about modifiable risk factors, these are the things that we can change. And we want to think about it from a muscle imbalance perspective, from a weakness and coordination. And the muscles that we want to improve are going to be the core, the hamstring, the glutes, and the calf muscles. The research has shown that those with a history of patellofemoral pain syndrome are at a higher risk for an ACL injury. That being said, there are exercises that you can do to help reduce your risk of both patellofemoral pain syndrome and ACL injuries. In the next video, I'll take you through some injury reduction exercises that you can do for these conditions. Again, if you want some more information or if you have any questions, please reach out to me via email.